I was very concerned with a 22-year-old, walking the streets over here. I had no idea where this was. Would she be escorted back and forth to the hospital? Would she be taken, let's face it, she's 22 years old. All she wants to do is shop. Would she be taken shopping if she wanted to go shopping? And as it turned out, they escorted her everywhere she wanted to go. Escorted her to see me, picked her up, brought her back to the hospital, to the hotel rather. She was totally escorted the entire time. And any qualms that I could have had were totally just gone.
And your experience of the hospital here?
The hospital was better than I had read about it online and whatever, but you can't read online how sympathetic the staff is. All the time I was in North Shore Hospital, I had open heart surgery. I had my chest cracked open. I was in agony, much worse than this one. Okay, I never had a nurse there actually pat my hand. You're going to be all right. You're going to be all right. And here they don't even understand the language, and they're patting you and telling you, and you know that this is what they're saying to you. You're going to be all right, and you need this, after surgery. You need somebody telling you you're going to be okay. Because you don't have your family around you to do it, they can't stay with you while you're in, intensive care the whole time. So, but then she was allowed to stay with me 2 nights when I got out of intensive care. The first 2 nights I was in a regular room. There was a bed in the room, and she stayed in the room with me. So.
What would you say to other patients back in America or UK or anywhere else who's suffering from cardiomyopathy? And in the same sort of state you were in? What advice would you give them?
Beg, borrow, steal, mortgage your house, do whatever you have to do to have this done. Because immediately you can breathe again. I'm in pain, but I'm in pain from the incision. I'm not, in the pain of breathing the way I was. I've exercised twice a day. 30 minutes on a bicycle, which I couldn't do before this. I could blow my little balls on the little blowing machine. And it's great. It's just great already. And if it's this great now, how great is it going to be in 3 months?
What are you looking forward to being able to do in 6 months' time?
I'm looking forward to picking up my grandson, who's 35 pounds. And I can't pick him up. Okay? I have another grandson who was born while all this was going on. He's just 10 months old. Okay? And, he's at the point where he's starting to wiggle. Up until now it was fine. I could hold him in my arms, he stayed still. But now he's at the point where he wants to get up and down. And that's it for me. I won't be able to pick him up anymore. Laura, we're going to again. Okay? Hi, my name is Ann from New York, and the only outlook that I had was a heart transplant, and to me that was not an option. I like my heart. It's a very loving and giving heart, and I wanted to keep it. And it's totally incomprehensible that I could not get this procedure done in the United States where I live, that I had to travel halfway around the world to get it. But so be it. If that's what it is, here I am. And I'm already breathing better than I've breathed in an entire year. And everything has exceeded all my expectations. The doctors, the nurses, the hospital, the hotel. The Theravite staff is unbelievable. I had concerns about my young daughter coming with me and her being escorted, and she was totally escorted anywhere she wanted to go. So if you have this problem, make the phone call, call Theravite, and do it as soon as possible. See, my daughter, she finds everybody